Good evening. This is the scheduled monthly Board of Health meeting, Thursday, June 25th, 2020, 6 p.m. I'm Joe McCarthy, the board chairman, and this is a virtual meeting. So before we begin, I'm going to make the following, I'm going to read the following comment from the governor. Pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the open meeting law, General Law, Chapter 38, Section 18, and the governor's March 15, 2020 order imposing strict limitation on the number of people that may gather in one place. This meeting of the North Andover Board of Health will be conducted via remote participation to the greatest extent possible. Specific information and the general guidelines for remote participation by members of the public and or parties with a right and or requirement to attend this meeting can be found on the town's website at www.northandoverma.gov. For this meeting, members of the public who wish to watch the meeting may do so on their televisions by tuning into Comcast Channel 8 or Verizon Channel 26, or online at www.northandovercam.org. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately assess the proceedings in real time via technological means. In the event that we are unable to do so, despite best efforts, we will post on the Town of North Andover's website an audio or video recording, transcript, or other comprehensive record of proceedings as soon as possible after the meeting. If the public would like to participate in public hearings, please email your comments prior to or during the meeting to blaglasse@northandoverma.gov. That is BLAGRASSE@northandoverma.gov. The comment will be read during the proceedings and responded to accordingly. To open the meeting, we do have a quorum. Let me just go over people in the department and the board, and most important right now, our special guest, Town Moderator Mark DeSalvo. Mark, welcome. Delighted to have you. Can you all hear me?
Yes, thank you. Yeah. I appreciate you allowing me to come.
Okay, let me just a roll call go through the board members. Frank McMillan.
Here.
By the way, this is Frank's last meeting. He has been a member of the board for about 13 years. He is the prior chairman, and he is going to be sorely missed. Michelle Davis.
I am here.
Patrick Scanlon.
I am here.
Daphne Alva LaFleur.
She cannot make it tonight. She is at a graduation ceremony, virtual, but she's being honored for her charitable work that she's been doing through Tufts tonight.
Okay, let me go through the department members. Tony Wolfenden.
She's not here. She's on vacation.
Carolyn Everson. She's a public health nurse.
Here.
Brian, he's the director. Of course, he was
here.
Speaking. And last, Steve Casey, health inspector. And at that, I'm going to turn it over to Mark DeSalvo. Mark, it is all yours.
Thank you so much. I really appreciate the courtesy. First of all, to you, Frank, thank you for your selfless service to the North Andover community. I know that you've had significant influence on the public health of North Andover, and most importantly, have always been unafraid to step up, make a considered judgment, and own the results. And I, as a community member, and I know the rest of the community appreciates it. So thank you for your service.
Thanks, Mark. I appreciate the words.
An absolute delight. I needed to come here to share with you something that I thought was particularly important. And that was to thank you for your cooperation and participation in the planning of and the conduct of town meeting. Never before had I thought that I needed to consider the word safe other than what the fire department and the police department told me in terms of exits and traffic flow and the like. But COVID-19 has afforded a very, very different environment. I remember going to the selectmen in early March and hanging in the lobby waiting for an executive session to end. And Brian and I were standing next to each other. We shook hands, probably the last person that I shook hands with. And I said, Brian, I have no idea where this is going, but I'm going to need your and the Board of Health's help. And he readily said, our pleasure. You just let me know. Here's my contact information. And I shared the same. Little did I know that we'd become fast friends and true compatriots. Brian offered his assistance and expertise, and believe me, it was not only welcomed, but it was absolutely needed. And I had a reliance, as did our committee of planning committee, ad hoc as it was, had a reliance upon his and your imprimatur to quite literally every judgment that was made. And he was always, as were you, responsive, on point, knew how to say no, did it kindly but firmly, and most importantly, sought a resolution when in fact he had to say no. It was a very different experience, but I do want to tell a little bit of a secret. I don't know who's listening in the public right now, but we spent a significant amount of time putting together the protocols for this meeting. I shared them with other moderators across the state. I can tell you a minimum of 4 instances where every word of that protocol was adopted, other than swapping out the word North Andover for another community. Even the sort of inside things that were in there that were really specific to North Andover. That's how well written they were in terms of the contribution that you and Brian made. And I know that it's become, both in terms of layout and in process, a template for other communities in the state. Frankly, most every other open town meeting community in the state who has had an outdoor meeting, even to the point where we were discussing the indoor meeting opportunity for a dispersed meeting, which we rejected out of hand, but had put together at least some preliminary understanding about how that might work. And those few communities that are choosing to do that have adopted those interim protocols that we had. So North Andover and the Board of Health and Brian LaGrasse have had extraordinary outsized influence. And it was just imperative for me to say thank you for a keystone member, really the most important member in terms of allowing us that hurdle of how to go forward. And I just had to publicly state that to those people that you work for and those people who are the benefit of your work, Brian. Thank you to you and your staff.
Thank you, Mark. I appreciate that very much.
It's
Mark,
simply deserved.
I couldn't agree with you more. In getting back to the town meeting on the 16th, I was very impressed. I don't think I missed a town meeting in 30, 40 years or so. I mean, you kept it light, yet meaningful, and it wasn't divisive. You were on point from a health and safety perspective. I have no criticism at all. I don't know how it could have been done better. So kudos to you and your people, and also to our Department of Health. Look, as a member of the Board of Health, we do provide oversight, but the department, they're the workers, and they did a real fine job working with you and your people. Great.
No question. And I had the easy part. It was an absolute collaborative effort. And that collaboration isn't something that happens, at least to the level in which we seamlessly seem to collaborate as a community, in most other communities. And it made it enormously easier. And the credit goes to the staff that's been developed and the kind of personnel that you hired and that Brian represents. Just thanks. I can't say it more strongly, but you truly were collectively a keystone.
Big hand to Brian and team.
I agree. Here, here. That's a standing O for you, Brian. So
And
Thanks.
Mark,
No, and, I was impressed with how smoothly the town meeting went. Your attention to detail was second to none. You had every single thing covered from start to finish, which was super impressive.
well, you made me cover it. So
You did IT, the setup, the layout, the supplies, everything was literally thought of ahead of time, planned for, planned out, and implemented. So kudos to you too. Great job for an ad hoc town
back
meeting,
at you.
bellwether, everything.
Back at you. Oh, that's a nice pickup, bellwether. Very good.
Mark, this is Joe again. Going forward, please, you're welcome to attend any of our Board of Health meetings. Now, this is a regular monthly meeting, but in addition to the monthly meeting, certainly during the coronavirus pandemic, we've been having meetings every 2 weeks or so. But feel free to join us.
I suspect that town meeting, even if there's no special town meeting in the fall, if there's another town meeting in the spring, when there will be another town meeting in the spring, I suspect that we'll be under some continued advisories here. So you guys are on my speed dial, and we'll continue that close collaboration. Thank you.
Awesome.
Thank you.
Thanks, Mark. I appreciate it.
All the best to everybody. Enjoy the meeting, and kudos again to you, Frank. Good luck. Enjoy the Great North. All the best.
Thanks,
Right.
Mark.
Thanks, Mark.
Bye-bye, everybody.
Okay, getting back to the meeting, communications, announcements, and discussions. The focus of our meetings for the last few months have been, and unfortunately will continue to be, the COVID-19. And for that, I'm going to turn it over to Brian and the members of his staff, and then hopefully members of the Board of Health will just have a few things to say too. So Brian, it's all yours.
All right. Thanks, Joe. So right now, Massachusetts today had another 172 positive COVID-19 cases. There were over 7,000 or 7,300 tests performed. It's a 1.9% testing rate for positive, which is fantastic. Hospitalizations are down to 937. Cases per day for the past several days, the week, have been pretty consistent and right around the same area. We're talking about yesterday was 229, and before that was 149, 125, 286, 228, 271, and 266 over the last 8 days. So we're looking pretty steady, pretty consistent. The numbers are basically have been trending down since last month, and they're going in the right direction. And I think that is extremely important to acknowledge. And one thing that we're worried about with this trend is people getting complacent. I think that is something that we're going to keep our eye on. More things are opening up, more people are getting out and about. If people get complacent and start not wearing their masks in public, not social distancing, then we could see the trend go in the other direction, which is what we don't want. So we need to encourage people to keep doing what we've been doing for the past couple months, keep the trend going in the right direction, and keep doing what basically got us to this point. Stephen and I did draft up a PSA that we sent out yesterday to basically state that exact same thing, to encourage people to maintain their masks in public and social distancing, and kind of go from there and be vigilant about it. And if you see somebody, you might not want to say something, but just keep in mind, if you see your friends or family, bring it up, talk to them, let them know the right thing to do. I know you guys have probably heard about the South and the West in the country are starting to see spikes. There are very different theories on why that is, but I mean, one of the basic things would be they probably opened up too early. They don't have the mask orders that Massachusetts has in place. Some of the states in the South and out West are actually looking to do that now. Obviously, it's a little bit late in the game, but it's better than nothing if they can get some of these things passed and start to help curb their spikes and kind of get back on the right track. So keep that in mind. It's Department of Education also released initial guidance that came out today. One of the things that they were talking about was overall pediatric studies and things that they've been learning about that and how the pediatric community has been seeing COVID-19 in kids. Is we want to get kids back to school in the fall. This is the very first initial guidance that the state came out with for Department of Education. And initially, they're talking about having the kids go back to school in the fall, maintaining 3-foot separation instead of 6 feet. And they went into a lot of the studies and a lot of the data that they looked at in terms of pediatricians and things like that. With it seems like children are less likely to get COVID-19 than adults. They're less likely to get sick. They're less likely to get severely ill, and they seem less likely to transmit it to others as well, which is opposite of things like the flu. So they're learning. They're kind of keeping tabs on things and studying the data and kind of going from there. But where we are today, we're looking at phase 3 in a couple of weeks. I don't think a date has been set, but they're talking about around July 6th. So after July 4th, they're looking to open things up a little bit more and getting into phase 3 of the 4-phase reopening phase of Massachusetts. So I'm going to pass it off to Caroline to give some local numbers for us and to give her update now.
Brian, quick question for you.
Yep.
What does phase 3 include?
Phase 3, it includes, let's see, I've got my list here of all the different phases. But phase 3 is going to be looking to do more youth sports, fitness centers and health clubs, maybe moderate capacity movie theaters, museums, aquariums, additional outdoor venues, outdoor concerts, moderate capacity, non-athletic instructional classes, arts education, life skills for more than just the youth. So like your little leagues, your softball, things like that can start to actually play games and scrimmages versus just non-contact drills and practices. So also talking about maybe moderate capacity weddings and gatherings in parks and reservations and open spaces.
And then I had one other question for you about for food servers wearing gloves. The whole glove thing kind of drives me a little crazy as a healthcare provider because gloves are not necessarily preventing spread of the disease, because I've not in North Andover. My wife and I went out to dinner over the weekend, and we would watch all the waitresses wear gloves, but they would go from table to table wearing the exact same pair of gloves. I think it just leads to complacency as opposed to not wearing gloves, gelling between each table and things like that. I was wondering if you could clarify what the mandate is as far as gloves with food service.
Gloves in food service is typically used in the back of the house for food prep. So if you're preparing, and this traditionally gloves and food equates to bare hand contact with ready to eat food. Now with the new COVID things in place, gloves are supposed to be still maintained for single use only and not meant for going from task to task or table to table. So I think there's a misnomer that gloves basically prevent the spread. I think what they're used for is to keep their hands clean, but they're not doing anything by not changing their gloves out. They're not using it properly. They have to be educated. And we've sent out information to other restaurants about proper PPE use, as well as guidance on gloves and masks and things like that. So we can revisit that again. That was probably a couple of weeks ago we sent that out, and it may need to have to be reiterated and discussed again. But yeah, most people wear gloves to keep their hands clean when that's the opposite of what you're supposed to be doing with gloves.
Correct. It was driving me crazy.
Brian, before you turn it over to Carolyn, I just want to further comment. You mentioned schools in the fall. I read in the paper that second grade and above they'll be required to wear masks. That's subject to change. I don't see a second grader wearing a mask all day in school. But when it comes to the coronavirus, every day I track the Institute of Health Metrics and Evaluations numbers, and to date, approximately 125,000 Americans have died from the coronavirus. And they are predicting the number changes literally on a daily basis, but perhaps another 75,000, could be 175,000 more deaths between now and October the 1st. If that is true, then that's going to have that's going to have a negative impact on reopening of the schools in September. It just might not happen. So just based upon the numbers, that's my gut feeling. And another comment, I was reading that 61% of the COVID-19 fatalities have been in residents and assisted living and nursing homes. And in Massachusetts, 2/3 of the deaths are for people over 75. In people under 45, it's 2%. Having said that, we have to really be careful and diligent. This has been my day. My son-in-law's brother, late 30s, died of coronavirus. I just came home from his wake. It is horrible. So sometimes we think that problems happen to other people, but more often than not, we are that other person. So yeah, people old, I think the average age of death is 81, but people of any age die of this horrid virus. And it struck my own family, and it is brutal. So just be careful. I apologize for interrupting. Callan, it's all yours.
Thanks. So for the town, it's been pretty quiet over the last 10 days. I shouldn't say that word. But we have held steady at 340 total cases with 3 active cases right now and 35 deaths. So, and that has been the case. I'm just currently following the few active cases that are left, anyone who's quarantined. The nurses that were helping out have wrapped up when school was over on the 15th. Other than that, I've just been fielding other calls. We've been getting some positive antibody tests, and those are the probable cases that are reflected on the state, website. We don't track them on the town side, but we still do get people who test positive for antibodies, but when they are swabbed, they swab negative. So they still need a little bit of follow-up, not as much. We also had a successful blood drive this past Saturday at the senior center. On the 15th, they started testing all donors' blood for antibodies. So I think that in itself, and the fact that there's, still quite a need out there, just, a lot of people came out to donate, which was great. And just catching up on all other things, public health, trying to get, into the swing of the new vaccine schedule, any changes to it. We got the sunscreen dispensers up for the summer with Steve's and DPW's help, and trying to kind of imagine what our fall is going to be like with flu season, and trying to creatively think of how we can rearrange that and do things. So that's pretty much it with me.
All right, I guess we'll head on over to Stephen.
Hey guys, so a lot of what we've been doing now is providing guidance just because of the change in phases, at least since we last talked. We've been talking to numerous businesses and residents. We pushed out a permitting process with the rest of the town as far as outdoor seating goes with restaurants to try and get them up to speed to help them out. And then we also did some site visits and inspections on those as well, just to make sure they were in compliance, or if they had questions and wanted us to come out and take a look, we'd go out. We also sent out a bunch of PSAs. One was on the limited indoor seating now. That's part of Step 2, Phase 2. With the help of Megan Baldwin and Bridget Sweet from Sweet Safe LLC, we hosted a Zoom webinar for restaurants when the outdoor seating was originally coming out and getting into effect, just to try and provide some pointers and answer questions where needed. We sent out information to food establishments regarding the PPE kit that Andrew Shapiro helped put together to provide PPE to local businesses in town. I've still been receiving and responding to complaints and providing information and hopefully answers as well on any inquiries that come in as far as businesses reopening and different procedures that should be in place. I may have said this last meeting, but it seems like things are starting to get a little more routine as far as my schedule goes. I'm still doing inspections on septic systems. I've done housing inspections, and we're beginning pool inspections as well. Only one is open so far, just because the EEA put out new guidelines that they want followed as far as COVID-19 goes, and it's tough for some places to come into compliance with it. So some either won't be opening or they're just taking a little longer to get open to make sure they're in full compliance. Caroline touched on this, but we got the sunscreen dispensers up and running at the public parks. They're at Carl Thomas, Reynolds, McAvoy, and Drummond Park. And there's also one at the Stevens Pond. We worked with the staff over at Stevens Pond as well to get them up and running, basically open them up, try to provide guidance and information on any questions they had, especially with the new guidance on COVID-19 and beaches. The farmers market is also up and running. And then I've also just been helping out the senior center a little bit with any food deliveries or taking in donations and things like that. So that's pretty much what I've been up to.
Pretty good. Definitely a lot going on over here. Any questions for Stephen?
Nope.
Just another comment on the COVID-19. Certainly not to segue from the regulations, but going forward, do want to include mental health issues. To that end, I have spoken with Deanna Cruz Lima. She's the town community support coordinator. She's a UMass graduate. She has a master's degree in psychology. She specializes in community social work, such as mental health, addiction, substance abuse and use, life adjustment, personal family matters, transition and changes, social, emotional, and behavioral challenges in schools, et cetera, et cetera. Very impressive resume, very impressive woman. And she'll be joining us every now and then going forward. I have spoken with Brian about that, and he's very, very supportive. I'd like to turn it over now to the other members of the board to see what they have to say, if anything was happening with them, and then end it with Frank. So with that, Michelle, comment?
I just wanted to say I got the update this week with the Keep Up the Great Work PSA and message, and I thought that was such a great message. I'd love to see if there's any way to start getting people in the community to really spread it or share it on social media, because I think it was a really positive way to reinforce people continuing to do their activities. And so I was sitting here trying to think of what else we could do to spread that message, but I think it really resonated with me. So hopefully we can get other people in the community to pass it along, or I don't know if any of our local businesses put up messages outside or anything like that, but just something I think really positive to show in the community.
Michelle, I'm really not that familiar with that. Can you further comment?
Well, Brian, do you or Stephen want to talk about the message, the PSA?
It was just what I talked about in my opening discussion piece about reiterating the fact that people need to keep up the good work that we've been doing, what we've accomplished so far with wearing masks in public, social distancing, and eliminating the transmission of COVID-19 through everything that we've been doing with just good practices, good hygiene, hand washing, hand sanitizer, masks in public, and staying away from large groups and social distancing and following the guidelines. That is what we need to keep doing. And if people get complacent and stop doing that, we could have an uptick in cases and start going in the negative direction versus the positive direction. Getting that out on social media, if you have it, sending it to your friends, putting it on Facebook, would be greatly appreciated if anybody can do that.
I tell you, speaking of social media, even our own town website, it has a wealth of information on COVID-19. very impressive. And we get updates almost daily from the town. So good work, real good work on that. Patrick, any comments?
I will yield my time to Frank. I had all my questions before to Brian. I will yield my time to the man of the hour.
I tell you, this is a bummer. This is it for Frank. I mean, we started pretty much the same time. I think as just a number of months before him, and now he's not only not going to be on our board, but not even going to be in our state. And Frank's a dear.
Live free or die.
And John, you're going to be missed, Frank, big time. And some of us are getting together later tonight, and I'm sure we'll have a good time. Let me just leave it at that. Frank, it's all yours, and you have the final comments.
Well, I'm gonna economize in my comments, but I would like to say it's been an absolute pleasure working with this health director, this department, this board. It's been wonderful. My comments related to COVID are very simple. Massachusetts is the absolute leader in the country right now with regard to flattening the curve. There is a public health statistic called R0, and it basically is a statistic that measures how many people do you transmit the virus to in your contacts. And in Massachusetts, I believe it's down to 0.63. Anything below 1 is good. Anything above 1, and you get exponential spread. So it's my understanding that Massachusetts is leading the country, even though we were one of the most worst affected states because of a certain medical conference in Cambridge early on. But that being said, we've done a great job in flattening the curve, and I think Brian has said it, but I'm going to make it even simpler. 2 things: stay out of closed indoor spaces to the extent possible. When you go in them, wear a mask. When you're with your family and friends this summer, transmission occurs in those groups very efficiently, almost as bad as in nursing homes, because you're close with each other. You have relations and things like that. Keep your distance. Use outdoor spaces. The weather's nice, and if you need to be in a closed indoor space, just wear a mask. Just do it. Nobody should. You don't want to get this disease. I don't want to get this disease. So with that, I'll yield my time back to the chair.
Well, I really don't have anything further to say, other than, once again,
Mr. Chair.
But you're certainly going to be missed, Frank. And I tell you what, as with Mark DeSalvo, you have an open invitation to join us anytime in the future. And I do hope you'll do precisely that. So,
Joe?
Yes.
Can I chime in on Frank? It's Larry.
Oh, absolutely. Go ahead, Larry.
Thank you. First, Joe, I want to tell you how sorry I am about what you just said about your son-in-law. It's horrible, and I just wanted to tell you.
My son-in-law's brother that passed away. He was 37 years old.
Oh, my God. Okay. Well, that was very sad. I just want to congratulate Frank on his time as chairman and his time on the Board of Health. I was the chairman prior to Frank for about a year and a half, and I have watched the meeting, and I think without even watching the meetings, I knew Frank would be an exemplary chairman, and he is an exemplary Board of Health member. He's well-versed in speaking. He's well-versed in the rules of protocol. He's well-versed in his knowledge of public health, and it's been a pleasure on my end to have worked with everybody, including Frank, throughout all this time. And Frank, you're going to a new venture. I'm proud of you, and I wish you well. And just on a side note, when Frank took the job as chairman, he begged me to be his mentor. I had to spend weeks and months helping the guy. Only kidding.
Thank you, Larry. You're the best.
Later tonight, I'll be talking about him being my mentor too, but in a very light way. Larry, I apologize. I didn't realize that you were tied into the meeting.
I didn't want to interrupt.
And as you just noted that you were the chairman before Frank, and before Frank was Tom Tolbridge, and before Tom Tolbridge was Frank's father. 4 very, very impressive individual. And these are huge shoes for me or anyone to fill. So town is very fortunate that you all have worked so hard for us over the years.
Thank
And you
for
missed.
kind words.
Well, one funny thing, I hope it's funny, for Frank, I'll leave you with this, Frank. One thing I have that you'll never have, you're supposed to say, what's that?
What's that?
A head of hair. So
Well, at least you're laughing, Larry. At least someone's
At
laughing.
least I'm laughing. That's true. But I wish you well, my friend.
Okay.
Maybe next time.
Awesome. Thanks, Larry. Good to hear from you.
Thanks, Brian.
Hope you're keeping Topsfield safe and healthy.
Yeah, I'm on the board of health there too.
I know. All right, before we do any more adjournments or any other things, I have two quick things to go over. I did get a question from Gabrielle Friedman. She wanted to have this discussed at the meeting. I will definitely email her back and take this offline with her, but she's looking to know if landlords in North Andover are allowed to show occupied units to prospective tenants during the current COVID-19 pandemic. Are there laws, advisories, or statements from North Andover authorities of any kind against this practice that a tenant can refer to when requesting that their landlord show their apartment virtually only? We don't have any specific guidance on this in writing. I think that landlords do have the ability to show their units to prospective tenants. I think the landlord legally has to give notice to the tenant who occupies the unit, and it has to be reasonable notice, which we translate to be over 24 hours of notice in writing, whether it's verbally, a phone call followed up with a text, or an email with a read receipt sent back, something along those lines that know that the tenant actually got it and knows that the landlord will be showing the apartment. Obviously, when indoors, wear masks, social distance. Tenants have every right to be there when a landlord is entering their apartment. That is up to the tenant who occupies the unit, and it is their prerogative to be there or not be there. So there's no written guidance as to this not being allowed, but state law does allow it through the housing code, and that has not been changed. So I can follow up with her online if she has any more questions, but that's a question that I got prior to the meeting tonight. And then the other thing I wanted to discuss with the board is we've been getting a lot of questions regarding the Andover Rod and Gun Club is going to be hosting a private event on their grounds July 3rd. And this is where it's a little tricky, and I wanted to get the board's input on this. I've talked to Frank about it already offline. So we've gone back and forth with this a little bit. It's a private event, ticketed only, mask required. You can do a little fireworks display, and it is closed to the public. So it's not your typical town-sponsored fireworks event. And the guidance kind of goes back and forth on this particular subject, not specifically on fireworks, but talking about gatherings of over 10 people. Gatherings are not recommended in any confined indoor or outdoor space to more than 10 people. So 10 people is your limit on any confined indoor or outdoor space. The orders do not apply to unenclosed outdoor spaces such as parks, athletic fields, parking lots, things like that. So it's a public versus private, 10 versus more than 10. I didn't know, we don't really have a lot to go off of in terms of concrete writing on this particular subject. I did speak to the state today regarding this, and there's nothing that we can really do in terms of issuing a cease and desist prior to an event. You would have to do it, and the only thing we can do is issue a ticket. So it's a $300 ticket if they have the event and we tell them not to. I haven't told them not to. I told them to abide by all of the guidelines and guidance that we've previously gotten by the state. The state said it's a small to moderate size event. It's on private property. It's not access to the public. And they kind of didn't give me a straight answer, but said that they don't really have a big problem with it if it's controlled access and they can socially distance. So I want to toss it back to you guys, have you guys talk about it, and let me know what you think.
Brian, this is Joe. I certainly would be glad to speak with you and anyone else about that, but other than speaking, I'm going to have to recuse myself from any decision because I'm a member of that club.
Okay. Any other comments or questions or things to discuss and debate on this?
Just a question. This is Michelle. Did we hear about this directly from them? Did they seek guidance from us, or is this kind of just secondhand information?
No, he called me and I spoke to him a week and a half ago. And I gave him the orders from the governor and the guidance that's out there. So he could
Yeah.
look at it and let me know what he thought. And he did say they could maintain social distancing. It is an unenclosed outdoor space. It's unconfined and it would be closed to the public and it would be access is restricted to only the people that actually sign up for it.
So in other words, it's outdoor dining, so to speak, to put it into, and the reason why I bring it up is because if we're already into outdoor dining, practicing social distancing, wearing masks when you're not with it, you're not 6 feet apart, then I wouldn't necessarily see a problem with this as long as, I don't know this club, if it's reputable, that they would make sure that they are doing the appropriate recommendations and somebody there is enforcing that, then I can't necessarily foresee a problem with it.
I think one of the keys is enforcement on their policies.
Correct.
I think that's the key myself in terms of master would need to be mandatory and social distancing would need to be mandatory.
So this is Frank here. Let me just make a comment. Like Joe McCarthy, I'm also a member of the club, but this is a it's a gun club, and gun clubs have rules, and the rules are strictly enforced. I think if your question is this group going to enforce its rules? Well, that's the whole reason that it's able to maintain its safety record as a gun club. So I'm not a concern about that. Again, I'm technically conflicted because I am a member, but I think Patrick's point is well taken as far as, restaurants are doing this. This is going to be a group gathering on outdoor grounds to look at the sky and watch fireworks. They had to come to us beforehand because they had a vendor who was going to produce the fireworks. So again, they're not doing this willy-nilly. They hired a vendor who does this and specializes in doing this and has a license to do this. And so I think that this is a very responsible club, to answer Patrick's question, that they are around dangerous items. We all know that people can be killed with guns if they're not used safely and correctly and in an environment of rules. And this is a quality organization and a quality club. My own feeling is that, I don't think we have to endorse it, but I wouldn't feel that we have any interest in interrupting it either.
I don't have any other issue with it.
Okay, I appreciate that. And then before we adjourn, I definitely want to thank Dr. Frank McMillan for 13 years of service. It is an era coming to an end with your father before you and now you on the board for the last 13 years. Your father was on the board for like 20 years. That's impressive. So thank you for your service. Thank your father once again for me. I worked with him way back in the day. And it's somebody coming in is going to have some big shoes to fill. I can tell you that. And you'll definitely sorely be missed as a resource, as a proponent of town public health and safety. And the insight you have is second to none. So thanks, Frank.
Thanks, Brian. I appreciate the kind words, and it's been my pleasure to serve.
At that, if there's nothing else, need a motion.
Frank, one last motion.
Move to adjourn.
I'll second.
All those in favor say aye.
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 That concludes the meeting. I thank you, and we'll be in touch.
Thanks, Joe.
Thank you.
Nice job.
Thanks.